It whizzed past the bridge of my nose.
Yeah.
Luckily,
Don't look at me, Ted.
Had my aristocratic, finely chiseled nose been hurt in any way,
This would have been a good day for it to
Dr.
happen.
James Chan is here in studio to address it immediately.
Cosmetic surgeon, Dr. James Chan. Hello, sir.
My $1
Hello.
million
How are
face!
you?
And it went right by Dr. Chan, his surgeon eyes and everything. That could have been.
You're
right.
yelling at yourself.
Nothing to do with it.
It came from your direction, Ted. That's all I'm saying.
Well, yeah, he handed me the thing with a broken thing.
Oh, stop it.
Yeah, no.
Well,
You were here. Who's to blame? I know it's not me.
All I did was go to plug it in.
I can't answer that.
I had it in my possession for less than
I'm
3
friends
seconds.
with all of you.
So far, you are.
What was that?
Depending
That's
on
the
who
gavel.
you agree with it.
That's a gavel sound, and just because you have the gavel
you
sound
guys
doesn't
are
make you
upsetting the
right.
doctor.
everybody just calm down.
Dr. James Chan, or Jimmy C, as he likes to be called,
That's right.
Old Jimmy C.
Jim and Jimmy C.
is here in studio. We're going to talk about an upcoming seminar.
All right.
All right? Is
All
everyone
right.
fine with that?
All
Ted,
right,
you going to
that's fine.
fling anything else? Some sort of act of
Don't.
violence?
It's Mitch's fault.
Anything?
Oh, it's not.
So there's a seminar coming up in just like, what's today? In like a week, a little over a week.
A little over a week.
A week and a day.
Yeah. November the 12th.
Is that a week and a day?
Something
A
like
week
that.
and a day.
A week and a day. A week from Thursday.
Correct.
This seminar consists of yourself, our friend Dr. Workman, and our friend Dr.
Stafford.
Stafford.
Cosmetic dentist.
He's seen your teeth, hasn't he?
Yes, and my partner Derek is a patient of his.
Yeah.
He's elongating his teeth.
What?
He's going to have some long chompers when all's said and done.
Ted, did you know about this?
What?
No, you gotta. You
Derek-
can't just
Derek-
drop that and walk away from
Derek
it.
has had braces when he was a teenager, and for some reason his jaw has a line, so most of us have a little bit of an overbite, so our teeth don't match up exactly.
I have a massive overbite.
Derek's match up exactly, and over the years he's ground his teeth down. He has little tiny baby teeth. You ever seen his teeth?
I'm not bringing them to mind, but
They're
I'm,
itty bitty.
He has a delightful smile. I know that.
He's
It
got a
makes
great
me
smile,
happy.
but
When-
little teeth,
When Derek
so-
smiles at me, I smile too.
So right now he has braces on again, and then eventually Dr. Stafford is going to elongate his teeth somehow. Probably with magic. I'm not exactly sure how he does it.
Probably magic.
have you ever heard of this?
I think
He's
it's
probably going to
veneers
get veneers or something,
like
right?
that, yeah.
Yeah.
Or maybe
crowns
or horse's teeth transplanted.
Probably
Exactly.
that. Probably some horse teeth.
Yeah.
What if
That makes sense.
his gums recede at a surprising rate, and his teeth have already been elongated, and so he ends up having teeth that are like a beaver?
We'll go back to Dr. Stafford. We'll go to the seminar Thursday.
That's right.
Skinny drinking straw like teeth.
Wouldn't that be something?
It'd be terrifying.
It'd be kind of a cool look.
I don't know from all of this, but I do know that the seminar is free, although space is limited. Where is it being held this time
The
around?
Sentinel Hotel.
Beautiful
Okay.
place.
Yes.
And it starts around 6:30?
6:30 registration, and there will be appetizers, and then a presentation shortly after that by the 3 doctors.
Now, I have been to some of these presentations in the past, and I can't remember the order. Do you usually go first, don't you? It goes face, body, teeth.
Usually, but sometimes we mix it up. Dr. Workman may be going first this time.
Do you like doing it, or do you get nervous?
No, we really enjoy doing it because it's a great opportunity for us to talk to people in a kind of a relaxed setting and, present some information that's informative and have the opportunity to just mingle with people.
Now, the idea behind the seminar is if you have questions about plastic surgery, a particular procedure, the art of it in general, you can go and get a lot of questions answered and then interact with the doctors
That's
and
nice.
get some advice and even start the process towards making appointments and so forth. Why I like to go is to try to toss out questions from the audience that they won't be able to answer.
Brilliant.
And we love that about
yeah,
you, Dart.
they do. They're crazy about it. Get a little drunk first. What are some of the more common questions for people that can't attend the seminar? What are some more common questions that you, as the face doctor, get asked?
So I get asked a lot, what should I do?
Yeah.
Look at me,
Make me
fix
better.
it.
Right. What should I do? And really there's a process, and that's what we talk about in this seminar, what the aging process is like and how we address those different components of aging.
If you've ever looked at a picture, I'm sure I'm not the only one that does this, but a picture of a female celebrity, arguably in her prime, or like back when you knew them, and then today, and you look at their two faces and you try to figure out what's different. Somehow sometimes it's really, really hard.
It is, yeah.
You think, okay, obviously they're older here, but why? You don't see the wrinkles necessarily.
Yeah.
You don't see, they've had some work done, but you just, obviously this is a much older person than this person. what makes them look that way?
Yeah, so, plastic surgeons have looked at this question in depth, and more recently what we found is that volume is a big area that we lose as we age, and that's what changes the way we look. So by volume, I mean, the cheeks and the area by your mouth, the nasolabial folds.
Because it used to be all about pulling everything up.
Right.
And more, they're discovering that fillers are actually, well, first of all, a usually much cheaper and non-invasive way
Right.
of turning back the clock a little bit, but also that it actually does make you look younger than maybe a more strident thing like a facelift or pullback or whatever you guys are calling it these days.
The old
Right.
pullback.
The tuck up.
pullback from Jimmy C.
Jam and Jimmy C.
That's right.
Feeling old in the face.
Come down, see Jam and Jimmy C. For the old pullback.
Pullback.
Feeling old in the face? I'll pump you full of the plump stuff. Jimmy C. I'll come to your house. What besides that, when people just ask the general, like, what would you do for me? What are some areas of the face that people seem most interested in improving or targeting?
So, well, the question is, does this work for me or does that work for me? Should I get all therapy? Should I get a laser? And
Everybody should get all therapy.
Yeah, everybody should get all therapy. But that's the more common question. It's, what about this procedure? What about that procedure? And people get really focused in and they hear the marketing and they see the hype
Yeah.
and they want to know about a particular procedure when it may not be the right one for them.
That's right, because certain procedures will advertise heavily on TV and you'll see but you don't know if what you're seeing is Photoshopped
Right.
or and it often is, or if it's, some sort of trickery, and they'll make some new procedure sound very, very appealing, but that's the job of the commercial to make it so. That being said, all therapy is amazing. You remember what that is?
Is it the one that
It's the magic thing.
the radio waves?
Yeah, it's the magic thing that's frankly, like a vibrator, and then the person rubs it over your face, and it's
Massager.
kind of like hot. Yeah, it's like a
Personal
massager.
massager.
You rub it over your neck and jaw and wherever else, and it does a thing, and then over time, your skin looks good. Can you expand
Can you
on that?
elaborate if necessary?
Through science.
Exactly. So it uses focused ultrasound. It heats the deeper tissues, and when the deeper tissue repairs itself, it creates collagen, which gives you that lift. and
So
that
here's what's fun about it and what you have to know going in if you want this treatment. So say your problem is with your jawline, you're feeling a little jowly or whatever else.
Yeah.
So you go in, you have the old therapy. The instant reaction is that it tightens way up and you're like, yes, I look great. And then a couple days, weeks later, it starts to go a little away and you're like, oh, I lost it. But then over time, it starts slowly getting better. And then you're like, it's back again.
Yep.
What a roller coaster.
Exactly. Yeah, so once the swelling goes down, then you have to wait for the collagen to build up. You're exactly right.
It's like a gift that keeps on giving.
That's right.
First
I
it
love
takes and then it gives.
Yeah.
3doctors1goal.com is the website to go to if you'd like to register for this or future free seminars. They are limited as far as space and the number of guests that they can accommodate. Again, it's going to be at the Sentinel Hotel starting at 6:30. You don't have to get there right smack at 6:30 if you need to be a little later. But that's a week from Thursday, so that'll fill up soon. Go to 3doctors1goal.com to secure your place at the seminar.
Thanks, Dr. Chan.
Thank you.